Hi, I'm Dan Rackley with Advanced Urology Institute. We definitely see a lot of men with erectile dysfunction. That's another one of these problems that's probably going to happen to most men as they get older. Erectile dysfunction is really, it's multifactorial. There's a lot of things that are involved, but most men as they age will develop some degree of blood vessel disease, and that's probably the biggest risk factor for men in this country. It's the same reason we see a lot of heart disease in this country. The blood vessels that supply the coronary arteries to the heart are roughly the same diameter as the blood vessels that supply blood for an erection. And so, if a man's had any history of any sort of coronary artery disease, a good chance is that they are also going to have some erectile dysfunction. Not only that, but a lot of times erectile dysfunction is a precursor to heart disease. So sometimes a man comes in to talk to me about their erectile dysfunction and start asking them some questions about their heart, and it leads to an eventual stress test or EKG, and we find that they have some heart disease. So not only is it sort of nice to be able to have erections when a man wants to, but also erectile dysfunction can lead to the diagnosis of some other more severe medical problems. But certainly there's a whole range of things we can do for erectile dysfunction, whether it be some psychological counseling is often all that's necessary. Sometimes lifestyle changes like diet and getting blood pressure and cholesterol under control. And then of course we have pharmacological management. There's a whole host of drugs we can use. And then there's some surgical procedures. So it's a quality of life issue for most men, but it certainly is a big quality of life issue for a lot of guys. And so a lot of people, it's pretty rewarding to be able to help them in that regard.